we're gonna move on and we're gonna actually start doing a little bit. Let's start on this side. We're gonna do some mesh to do a little bit of mesh in here, a little mesh in here, and then we're gonna use some smooths. So we are, yes, beautiful. We're gonna use our meshes, and then I'm going to create my little port sites, a little pinch. So with this mesh, remember it's 16 16 threads, PDO threads, put together all into a mesh pattern. And see it's much thicker. And you want to make sure that there is no barbs on this, so you need to make sure the whole thing, like a smooth, goes all the way in, and then when you release it, that you hold it so that it stays in place. Okay. So we're going to start off on this side, and I'm going to create a little bit of volume underneath his tissue in here. So you have to give it a little bit of a mild push. We're placing it right in here, right where we want it. Let's spin it a little bit to release the thread. And see, this is actually not good. So when you have it that you didn't push it all the way through, or the thread did not stay where it is, and see, it pulls out. So in those cases, pull the thread out and you gotta reinsert a new one, just because that is not the proper thing when you see a thread sticking out. You need it to go all the way in. And so this is the reason why, even though I measured it out this way, I probably could have started a little bit further out, because I wanted the thread to stay up here in place. So we're gonna re-stick another thread into this area. I'm gonna hold it down and just make sure that the thread this time stays in place. So this time you can see, thread stayed in place. And we're getting a nice fullness into this area. So we're gonna do another one into this area. We're gonna put it up above and give him a nice little fill. So we're filling him right here. So twist one way, twist the other way, and you kind of feel as though it kind of unclips and unhooks, and then it's easy to pull out. I slowly kind of turn it as I'm coming out. Beautiful, beautiful. So you kind of see how that actually does a nice job of actually filling up in here. So people who have a little bit of temporal hollowness, you can use mesh threads to actually fill up the area. Alrighty, so we are going to place two mesh threads here and a mesh thread here to kind of give him a little bit of a volumization. So a little pinch from this side, a little pinch on this side. Here we go. So I'm going to start from this bottom one. I'm going to give him a little bit of volumization in here. So we place the thread in, hold down, twist one way, I twist the other way. It kind of feels like it releases. You kind of feel it underneath your finger. And we've placed it. Beautiful. I'm going to go to the next one. I'm going to place this one up above. Beautiful. I'm going to release it. Again, twisting back and forth. Twist one way, twist the other way, and you'll feel it kind of unravel underneath your fingers. And we're done. You gave him a nice little volume into that area. Perfect. Okay, so we've done this lower side. We've kind of volumized her back up slightly with some smooth threads. You saw the mesh technique in through this area. We saw the meshing of a smooth thread technique into this area. You saw the mesh being placed in here. You saw some PLLA smooth threads kind of being placed in through the under eye area. We're actually going to jump and do some barbed threads onto this side. These are going to be 20 gauge 70 threads into this area. Perfect, thank you. The reason why I use 20 gauge 70 is because you remember that the threads themselves have a bidirectional nature to them. So there's a certain portion of it, the tip portion of it, I believe in this one is about 2.5 centimeters of it is lifting. There's a transition of 5 millimeters that gives for a movement of tissue. And then the other last portion of it, 40 millimeters, is the anchoring portion. I'm flipping it around because I'm coming in from the angle from the actual brow itself instead of coming from the hairline. You can come from the hairline, there is no problem with that. Just make sure that if you're coming from the hairline that you're not getting any hair caught into the hole that you're going in there and dragging hair in there with you, because that is a potential site of infection. Okay, so because of that, I like to actually come from the brow area and actually head into the scalp. Because it's bidirectional, you have no issues with that. Just make sure you are using one that is a little bit more smaller in length, because you definitely need to get all of it in there so you get the right amount of lifting and the right amount of anchoring into the tissue. Okay, so we're going to create two little tiny puncture sites, and I'm going to grab a little bit of Hibiclens first. I'm going to clean her off this area, and I'm going to see what angle I'm going to do. So I want to do this angle, so a little pinch. And she's already numbed. I already numbed her in the pathway that I wanted to lift her. Okay, so we are going to start off with the lateral portion. And we're going to grab in. Make sure that you do give yourself some good tissue. You want to be in that subcutaneous range. You don't want to be super superficial. You're going to create a lot more pain, a lot more issues for the patient when you do that. So we're going to start sliding it in there. It may feel slightly uncomfortable to the patient because you're getting down into that scalp area. Just tell the patient that it'll be fine. Bear with you because you are getting down into the scalp. But that's where you're going to get the best anchoring, is by going all the way into the scalp area. And I kind of give it a little bit of a hub into this area. There we go. And I pull out this way. And I do one more on this side. Now, in the scalp area, I will always tell patients, sorry, it's a little irritating. You potentially have a little bit more irritation. They may feel a little bit more pain into this area. Sorry about that. Definitely afterwards, you want to tell them that they may feel a little bit more headachy. This area, anytime you do anything in this whole forehead area, brow area, there's a potential that the patient may feel a little bit more irritation in the scalp area. Forehead area. It's a thinner area. You put a big 19 gauge, 20 gauge cannula in through the area. It's pushing and displacing some tissue. So they may be not uncomfortable, but uncomfortable in a sense. But we're going to give her nice lifting through this area. And I do a little bit of lateral pull onto this area. And then we're going to cut her tissue. Once I clip it in place, perfect. Alrighty, so we've done a little bit of a cat eye brow lifting. And if you want to, if it's too heavy, if it's too lifted, you can kind of relax it out by going the opposite direction. But typically, you get a little bit of mild puckering around the face is not a big deal. You just don't want big puckering. Sometimes the small puckering will actually settle in over the next week or 2 weeks, so don't worry about that. It'll look fine in that aspect of it. But this is kind of what I'm looking for with a nice lateral lift to her brow area. Okay, so just hold pressure. I definitely smooth them out into this area. They may feel as though tenderness. You may get some swelling into this area because it's thin tissue into this area. So sometimes if you're doing your threads, take the time to actually just hold pressure into the area. If you feel as though an area is starting to swell a little bit more than you like, you may have bumped into more tissue, irritated more tissue, bumped into a blood vessel. Hold pressure on the area before you move on. You know, that will minimize the patient from having bad sequelae of a lot of swelling, a lot of irritation, a lot more pain afterwards. So I do put a little bit of pressure into the area and just kind of hold it there for a minute or 2 minutes. Same thing with smooth threads and everything like that. That's what you want to do. So we've definitely softened up everything on her, lifted up her brow, done her under eye area to soften up that. We put a mesh into her nasolabial fold. We put a mesh into her her zygoma and her cheek. You can definitely see that we've actually created more volume on this cheek by placing the mesh into this area. We've softened up her nasolabial fold by putting a mesh into this area. We put in a little bit, this is a little bit mild swelling, but we placed into this marionette area some threads. You can see that that's actually raised the corner of her mouth nicely into this area. Her brow is lifted as well. So let's let the patient take a look. Right? Two different people. So really, really softened up her under eyes as well. I forgot, well, we had done some PLLA, placed them underneath her eyes, did some nice lifting into that area. So amazing, fun results. All right, guys, go out and do it.